Good day, everyone, and welcome to today's roundtable discussion entitled Social Safety Nets in a Global Crisis, Challenges and Lessons Learned Amid a Pandemic. My name is Eric Mitchell, and I am the Executive Director of the Alliance to End Hunger. We are pleased to co-host this timely event with our friends and partners at FAO North America. Today's event is the latest in a series of congressional briefings and expert roundtables aimed at raising awareness about food security issues and policies. Before we get started, I would like to mention a few housekeeping items. Today's event is being recorded and live streamed on Twitter on the @FAO North America page. The recording will also be shared with participants in the next few days, and you can also add to the conversation on Twitter using the hashtag #SocialSafetyNets. Due to time constraints, I will provide short introductions of our speakers, and a link to all the speakers' bios will be shared in the chat box. We invite you to share your comments and relevant links or publications in the chat at the bottom of your Zoom. Please use the Q&A box for questions that you may have, stating your name and affiliation. Panelists are welcome to respond to questions in the Q&A box or offer their comments in the chat box while they are not actively speaking. According to the World Bank, an estimated 2.5 billion people are covered by safety net programs. These programs protect families from the impact of economic shocks, natural disasters, and other crises. However, social safety nets have been under tremendous pressure due to the current health and economic crisis. National budgets, both here in the United States and around the world, have been strained by competing demands for limited resources. At the same time, we also know that public safety nets are one of the most effective ways to keep individuals and families from falling into poverty. Additionally, these programs often spur economic activity in struggling communities. For example, the Supplemental Nutrition Assistance Program, or SNAP, in the United States has been shown to produce $1.50 of economic activity for every $1 invested in the program. Programs like Bolsa Familia in Brazil have had significant impacts on reducing hunger and poverty. According to the Center for Public Impact, the program decreased the rate of poverty in the country from 13% to 3% in 2015 and decreased hunger from 22.8 million down to 13.6 million people by 2012. As countries currently fight the health and economic crisis due to COVID-19, demands of these programs are skyrocketing. But as with so many other policy programs and systems, the crisis has highlighted shortfalls and deficiencies in the safety net programs, whether it's insufficient benefits or failure to meet the needs of those who are most vulnerable. We are receiving real-time lessons in what we need to do to improve our safety net systems and make them more resilient when the next crisis strikes. To explain all of this, we have a fantastic group of experts with us today. Michal Rutkowski is the Global Director of Social Protection and Jobs at the World Bank and will provide a few keynote remarks and insights. We will then move to our panel of 4 phenomenal experts on our topic. Benjamin Davis is the Director of the Inclusive Rural Transformation and Gender Equity Division at FAO. Asma Lateef is Director at the Bread for the World Institute. Valerie Schmidt serves as Deputy Director of Social Protection Department at the International Labor Organization of the United Nations. And finally, Arloc Sherman is the Vice President for Data Analysis and Research at the Center on Budget and Policy Priorities. But before we launch into Mr. Rutkowski's keynote, I would like to invite our good friend and partner, Vimlendra Sharan, to deliver a few remarks.
Thank you, Eric. I'm Vimlendra Sharan, Director of the North America Office for FAO, based out of Washington, D.C. Let me, on behalf of FAO North America and on my own behalf, extend a very warm welcome to all of you joining us for this webinar today. Special word of thanks to our panelists and keynote speaker for taking time out to join the discussion and to share their ideas with us. With, as Eric was mentioning, with COVID-19 threatening the lives and long-term livelihoods of millions of vulnerable individuals and families around the world, social safety net programs for fighting poverty and hunger have become absolutely critical. It's interesting to understand that in the development debate today, social protection programs are decreasingly seen as a cost and more as an economic investment capable of reducing poverty and promoting social mobility. Now, there is, however, a disagreement, or should I say, a difference of opinion on the type and focus of such programs and the best way to implement and finance them. The debate on what we can call the market-based versus rights-based approach towards social protection is far from settled. The former, those who support the market-based approach, argue that transfers need to be well targeted, for example, to the extreme poor, as in their minds, universal protection schemes risk disrupting the market and also do not provide adequate or any incentive for people to excel. But the latter group, those who argue for the rights-based approach, feel that there is an intrinsic value to social protection and claim that it is a fundamental right. And in their perspective, protection against vulnerability is a human right and thus needs to be accessible to everyone. Now, this debate will rage on and may never be settled, who knows? But it is important for us to remember, despite whatever the debates are, that for poverty reduction to work, the poor need access to food, nutrition, water, education, health, markets, safety, and security. Now, providing access to these needs, therefore, should be the basis for our social protection programs or systems. And that would contribute to inclusive growth. And that's the base around which we need to work when we think of social protection programs. In the end, of course, the choice between which approach to take and how to go about it, I guess, embedding programs in a broader development strategy, I think I will say would be a political one. And each country will obviously take its own course. At FAO, we view social protection as critical to achieving zero hunger and for building resilience amongst the most vulnerable. We work with governments and partners to incorporate social protection programs into national rural development policies, food security, and nutrition strategies. FAO emphasizes the critical importance of extending social protection programs and supports governments in designing, implementing, and assessing systems focused on benefiting the rural poor. More about FAO's work in this area, I think we will hear much more from Benjamin Davis, our Director of Inclusive Rural Transformation and Gender Equity Division at the headquarters. He will be speaking very soon and give us more ideas and of the work that FAO does in this arena. Let me stop here as I'm really excited to hear from our speakers. But before I do, let me place on record my gratitude and heartfelt thanks to our co-hosts, Alliance to End Hunger, for being an amazing partner of FAO for past many years. They bring with them the combined energy of civil society and the private sector, and in an endeavor to end global hunger and malnutrition. At FAO, North America, we are looking forward to further strengthening our partnership under the new leadership which Eric brings. So once again, thank you everyone for joining, and let me now hand over the floor back to Eric to take the proceedings forward. Thank you.
Thank you, Vimlendra. Really appreciate your comments, and like you, we really value our partnership with FAO North America and look forward to our continued relationship. I'm going to now turn it over to our keynote speaker, Mr. Michal Rutkowski, who's going to give us a few remarks on this issue.
Uh, Good morning and good afternoon, ladies and gentlemen. It's a big thanks to our hosts from FAO. It's an honor and a pleasure to be invited here and have a chance to address you in this important event. I see my role as providing you with some background for further discussion about social protection more generally, but more specifically when it comes to social protection responses to the COVID-19 crisis. And in that context, it is useful to start by looking at the world as we knew it before the COVID crisis. And if we do that, depending on how we look at the situation, we can be either optimistic or pessimistic. And I think the picture in front of you shows both sides of the coin, so to speak. On one hand, you see that there already before the crisis, there was a considerable coverage of social safety net worldwide. But you would immediately see that this coverage is much lower in low-income countries, two left-hand bars, than in lower and middle-income countries, middle bars, and then upper middle-income countries on the right-hand side, which is understandable. That is a function of resources the countries have. Looking more in detail, we distinguished here between all population and how covered by safety nets, meaning they have access to any kind of safety nets. And as you see there, we have progressivity growing with income, because in high upper middle income countries, bottom 20% are better covered by safety nets than the general population, and it is understandable because they need it more than the others. This is much more even in lower and middle income countries, and in low income countries, in fact, the bottom 20% is less covered than the general population. That was the situation there. And on the right-hand side, you have some rough numbers which come from our periodic study called State of Social Safety Nets in the World. The spending as a percentage of GDP is 1.5%, compared to spending, for instance, for social insurance types benefits, it's much smaller. Then a very important number you see in the middle, the 26, which is 26 is the share of social safety net transfers in income or consumption of those who are poor according to our definition. We are talking here about absolute poverty, poorer than $1.9 per day. And then in the lower part, you see the growth in social safety nets, which was quite considerable between 2010 2015 compared to what had been there before. Those 14 programs introduced per year in Africa per year is a considerable growth, much faster than ever before. In fact, the 21st century, even before the COVID crisis, can be characterized as the rapid expansion of social safety nets worldwide, including in low-income countries, including in Africa. Still, if you again get to the table on the left-hand side and look at the left two bars, especially the dark blue bar, 15.6, it means that only 15.6% of those who are in bottom 20% in low-income countries have an access to any kind of safety net. So no wonder that we in the World Bank were talking left and right before the crisis, let's close the coverage gap. And by that, we mean really close a huge gap, which is especially important and especially painful for those in low income countries who are in the bottom 20%. With that, let's look what happens with COVID upon us. And as one would expect, there is a tremendous response in terms of various ways of improving welfare of those affected by COVID. Here, this slide is limited to essentially one thing, comparing the response after the financial crisis, 2008, 2009, and 2020 response. And this is basically an average size of this stimulus package as a percentage of GDP. And you would see that the response in 2020 was far more robust than in 2008, 2009. This is a general, this is a percentage of a stimulus package in GDP. But then we also, in yellow circles, you see what was the value of response in social protection, and then it is bigger, predictably and correspondingly with the average size of the package in 2020, 800 billion, then in 2008-9, 353 billion. So there has been a robust response, or actually there has been a more robust response than in the previous crisis of 21st century. Given the audience and given the context I am talking to you today, I will make a few inferences related to food and malnutrition, because of it's of obvious interest to you and possibly the audience. And here, a certain warning signs are in place, and I am sending them now. Here you have actually some data showing that the number of undernourished people in the world continued to increase in 2019, and if recent trends are not reversed, then there is a risk for the SDG 2.1. And this data, which I believe come from actually FAO, or in part from FAO, show both in terms of the yellow line is in absolute terms, and then millions of people they are, and then the black bar is percentage scale on the left, millions scaled on the right. In both scales, you see the growth which took place, and this is obviously a dangerous sign. Then let me also mention that what we essentially have seen between 2010 and 2009 is a decrease of number of wasted children, which is very much obviously a welcome sign. But then this has been reversed in 2020. And this is a very worrying sign. So let me put it on the table that despite what I already labeled as a robust response, that the problem is upon us big way related to wasting, which means related to all kinds of stuff related to that, and being a corollary of that, including deficiencies in early childhood development and the consequences. Now let me now move to the scale up of COVID-19 responses, and this is really fresh off the press, so to speak. It's December 11th. Today we have December 16th. So we have, I believe, a robust system of monitoring of world responses to COVID. And a colleague of ours, Ugo Gentilini, provides many of you with updates on that on our behalf. We have the whole machinery working with colleagues with some other international institutions, notably OECD. Here, please look from on the left-hand side. Please look at the very rapid growth of the responses. 215 countries responded in some way, introducing 1,414 programs, and the growth has been tremendous. You see growth here between March, which was by and large beginning of COVID crisis in most of the countries, and certainly in Western Hemisphere, but also in Europe, Africa, and in South Asia, as opposed to East Asia, where it started earlier. And then on the right-hand side, we did a certain, we tried to disentangle these responses into types of interventions. And starting with the lower part, you have social assistance. By the way, when I say social assistance, it is exactly means the same as social safety net. I use those terms interchangeably because cultural differences are out there. You would never say social safety net in Eastern Europe. You need to say social assistance. You, however, would say social safety net in Latin America or in Africa, and that means the same non-contributory benefits of last resort, helping people to improve on their incomes and consumption. So social assistance essentially constituted majority of responses, 62%, and you see it, what is up there in yellow circles is a replication of is average for the world. Social assistance dominated. Within social assistance, you can help with cash or in kind, and then cash transfers were 33% of those. And then in the lower part, you have this disentangled from the left high income countries low-income countries, lower and middle-income countries, upper and middle-income countries, and the world. Again, you see clearly the dominance of social insurance measures. And then obviously, as we move up the income ladder, then you have a larger role of social insurance. And then in gray, labor market policies, which when you look at worldwide, it's 14%, it's 21% in high-income countries, predictably. Primarily, interestingly, in Central and Eastern Europe that reacted, and in Europe more generally, that very much used active labor market policy, the Kurzarbeit response. But on balance, social assistance was dominating the package, very energetic response, very dramatic increase. We usually disentangle the response in social assistance into vertical and horizontal. And then vertical, it means how adequacy improved. This is left-hand side, where the package is more generous. Will more money well transferred to the needy? And on the right-hand side is, did programs grow? Did they cover more population? Did the horizontal response happen? Both happened big way. The horizontal response, the scale up 240% compared to the preceding, disentangled into several countries. So you can also study the differentiation of response across countries. On the left-hand side, the same adequacy, the size of the benefit, and then you can study as well the differentiation among the countries. Now, what is interesting to see, and this is the question policymakers, technicians always ask. I mean, okay, that's all fine, but did the countries implement as intended? Because so many programs in the world are well-intentioned, and then you know, you know what's paved with those good intentions often. Here it wasn't the case. In fact, we consider the implementation progress as being quite remarkable. There is only 2.3% difference between what was intended, which is in blue when you look country by country, and actual coverage, which is in yellow. So basically what was planned was implemented by and large, which is good and which doesn't always happen. However, here let's put a few qualifiers on all these things. So the first qualifier is that the programs are really generally short-term. Average program duration, as we estimate for the March to December period, is 3.3 months. And then for all those 429 measures, only a few, well, 32 out of them were extended on average for an additional 2.8 months. So we decisively talk here about temporary programs. And then in the graph itself, you have those 3.3 average duration, which I already referred to. And then you can see a bit of variance as we grabbed from the countries in question. So the average masks differences, but I think average here is important because we want to know how lasting are those packages. And I'm not making a judgment here that the longer they last, the better. It's quite understandable that some of them are temporary, but I think it's good to know given the background nature of my presentation. This is something which for us in the World Bank is so important because we very much moved our, in a way, emphasis. We've always been interested in policies. We've always wanted to help our clients with right policies. But for last, I would say, 2 decades, we really focused on implementation capacity, on the nitty-gritties, how you actually make sure that the money ends up in the hands of intended recipient. And here we were trying to see what explains the ability of countries to scale up. And the answer is that delivery capacity at the outset, the existence of social registries. And if social registries don't exist, the existence of a combination of at least 3 elements: mobile money, financial inclusion, and identification numbers, the JAM Trinity, as it's called in India, based on acronym coming from M staying for mobile money, A staying for Aadhaar, which is identification number, and J including financial inclusion. It shows that it plays an important role. The countries that have social registry, which is in the sort of, I wouldn't say maybe gold standard, but it's really great to have one. If they had social registry, they were able to expand cash transfers, horizontal coverage, horizontal, expand programs better, and that's why we have this upward sloping line with R squared in 0.37, but still it indicates the relationship between initial delivery capacity and expansion. Well, several buts, which are very important here, and qualifiers that from new cash programs, new cash were 63% of all, of which one of 30%, 3.3 duration, I already said that. And then per capita, it was, if you know, mere $6 per capita. Now, here is a very important point, and it is a policy point, not really, although it quickly becomes a delivery point. The question is, and let me characterize it this way. Even before the COVID crisis, in the World Bank, we were using the term missing middle, indicating those who are in the informal sector in urban areas. Why? And we are doing it most notably in the book I have in my hand, which we call the white paper on protecting all. When we pointed out to the fact that formal sector workers in developing countries are covered by formal programs. Informal sector workers, the poorest in rural areas, are often covered, with all the gaps in the coverage, by big cash transfers, often financed by donors combined with the government. Where the gap is are urban informal sector workers not having access to any of those and very vulnerable. And what happened is that the COVID crisis precisely exposed this vulnerable group the most. They were hit the most, and they neither could rely on formal programs, nor were they covered by cash transfers of last resort. Here in this graph, we do a bit of disentanglement of who they are. So we classified everybody into 4 groups, and then those 2 groups on the left and right, formal in green, you know what we are talking about, those who even have formal pension schemes working for state-owned enterprises or private, but this is very often, like in India, 10% of the economy. And then informal poor on the left-hand side, they often have those cash transfers. But then there are those 2 groups in the middle, in blue, light blue, informal, non-poor, vulnerable, and informal, non-poor, non-vulnerable. Well, they are non-vulnerable, meaning they may not need cash transfers, but they need some social protection mechanism. And here a big issue appears, which we are working big way on, how to make sure that those groups in blue have an access not only to social assistance when they need it, like in COVID, but also to social insurance so that they have some risk management mechanism for themselves. And I think I want to draw attention to the missing middle as being the most vulnerable group in the COVID crisis. Given the important context of that conference, I wanted to refer to the fact that, since I mentioned missing middle is in urban areas, so the question is how we can have this integrated approach covering both rural and urban areas, certainly for social safety net, but also for food systems. And one of the biggest things for us is actually adaptive social protection. You have the cover page on our new book, published a few months ago, but we had worked on this book for quite a while before the COVID crisis, which nobody expected hit. So it was very, very timely, because adaptive means able to scale up and scale down as needed. And this is extremely important in the COVID crisis like that, when some measures need to be temporary by design, but also to be able to get to those pockets on the map, which you see there, how to get there, what databases to use. And in so many cases, we don't have social registries, we don't have these jump things. We need to use ad hoc things like, but I mean the World Bank, working with governments like mobile money operators, coverage data, so that we can get into this pocket. This is a big challenge, both food and cash delivery to urban informal sector. And how to combine expanding urban social protection with strengthening rural resilience. I think it was my last slide, so I like to finish just on saying something which refers to what Mr. Vimlendra Sharan said in his introduction when he contrasted the approach based on the market and the approach based on rights. With all due respect, I would say that the difference here, in my view, is more related to semantics than related really to substance. And sometimes it is related to how we interpret an event as something which we both support. So what I wanted to say is that I think we are all, and by that I mean international organizations, united by the vision of having at the end of the day, universal social protection systems, meaning that everybody who needs social protection has an access to social protection. Where the differences may appear, and I think this is what Mr. Sharan referred to, rightly so, is that some of us would more emphasize that first, the social protection needs to go to the poorest and most vulnerable. And this is ultimate, it is both economically sound, it's a moral obligation, and we would argue that. And then there would be others saying maybe we should address everybody at the same time, maybe based on rights. So I'm not denying the difference is there, but the difference is often a bit, I think, overblown, and I give you an example. I think all of us, and here I take a risk of speaking for too many, but most of us support universal child grants. We believe that very often there is a systematic correlation between, poverty and the number of children, and supporting children is so important given the impact on human capital and everything, the investment in the future. But what is the universal child grant? So you ask some of us, and they say, oh, it's a universal benefit. Every child gets it. It is a principle of universality is there. And then ask some other of us, including me, and I say, oh, it is a targeted benefits. You use categorical targeting, and the category you target are children. So it's a great, and if there is a systematic correlation between poverty and the number of children, it's a great targeted benefit covering all children. But then for others, it will be called universal, but we are talking about exactly the same policy instrument. So sometimes I'm saying it because sometimes we call differently the same instrument. Some of us would call it targeted, some of us would call it universal. And then we are talking exactly about the same, and we actually share most of the principles. So that's why I wanted to say that I think this difference between market-based and right-based, even though there is something in it, and there are certain real differences with respect to where we start, how we prioritize, but by and large, it's not like two different wells, which different priorities, different instruments, different policies. It is more like a discussion that is about fine details, about priorities, legitimate under any scenario, so important in the current COVID crisis, to which I was trying to give you some background in my presentation, which may have gone slightly over time, for which I apologize. And I would like to thank very much FAO and colleagues for having this chance and honor to address you this morning here in Washington. Thank you very much. And I think over to you, Chair, for further proceedings. Thank you.
Thank you, Michal, for such an informative presentation and for your remarks. I'm now going to turn it over to our first expert panelist, Benjamin Davis, who is the Director of Inclusive Rural Transformation and Gender Equity at FAO. Benjamin, would you please share your remarks, followed by some brief questions?
Thank you very much, Eric, and hello to everyone. I think I'll take off where Michal finished and try to get a bit more granular and perhaps explore some of the roles that social protection plays. I think focusing first on who's paying the price of COVID-19. COVID is certainly not the great equalizer. If anything, it's the great unequalizer in terms of its differential impacts. Women are clearly paying a very high price with the double, triple burden of care, and taking care of the sick and children out of school. They're the first to go and the last to be rehired. Usually they have more informal employment. And there's been a reduction in non-COVID related health services, particularly reproductive health, which have very long-term consequences. Indigenous peoples, historically marginalized, disenfranchised, insecure land tenure, and have been subject to increasing violence around in a number of parts of the world. Migrants, clearly informal workers, as was highlighted in the previous presentation, and the poor in both urban and rural areas. I think it's also important to note that the existing inequality magnifies the impact of the crisis. And there's been important work by the World Bank showing how the increasing Gini caused by the crisis will have a much bigger, will make a much bigger impact of poverty as we go into the future. It's also clear there's been a very immediate impact on food security, as we saw with children's wasting in the previous presentation, as well as surveys from many countries showing immediate drops and immediate increases in food insecurity. But there's also the threat of negative risk coping strategies around the sale of assets, increasing child labor, and all of these have long-term consequences in terms of welfare, sometimes generational consequences. I also just wanted to point out that 80% of the extreme poor prior to the pandemic lived in rural areas. They primarily depended on agriculture, at least in part, for their livelihoods. The vast majority were informal, again. And again, most of these rural workers and informal workers are excluded from employee-related social protection. I think the great existing inequality across a number of dimensions, and again, particularly in rural areas, between rural areas and urban areas, is also very important in terms of understanding the impact of the crisis. And that's in terms of access to health insurance and services, sanitation, education, the ability to manage risk, having access to birth certificates and formal identification, which is sometimes an impediment to getting access to social protection programs, etc. And so that's also, I think, important to understand in terms of understanding of how this plays out, particularly in rural areas of the world. And I think it points to why social protection has been the first response for most governments of the world. And again, thank the World Bank and for Ugo Gentilini for really the great job they've done in terms of keeping track in real time the evolution of social protection programs. And it's clear, I mean, there's the immediate support which gets into the hands of the people directly, but it's also important in terms of protecting incomes and ensuring food security and basic needs. But also, I think it's important to stress the prevention of negative risk coping strategies. Again, as I mentioned, in terms of selling assets, child labor, keeping children out of school, even as schools begin to open up again. But it's also fundamental in terms of addressing the demand side constraints, for example, to health services and accessing health, as well as facilitating compliance with confinement measures. We've seen there's a massive response in terms of social protection, but there's also gaps, as I think, which was also alluded to in the previous presentation. Again, the temporary nature for most of the programs. Most of these don't address specific vulnerabilities faced by particular groups, and particularly women and girls, and the burden of care, indigenous peoples, the informal sector in agriculture and around food systems, migrants and seasonal workers. They do in some cases, but in general not. The coverage in lower incomes, as was indicated, is still very low. And in general, lower income countries tend to have less developed social protection systems. And they're often patchy and with more challenges in terms of identifying target populations and reaching them. This is particularly difficult in rural areas where you have the remoteness, often low density of population, high mobility, and the informality, which may hinder access to social protection. I think one role that I really want to focus on is as we move towards the recovery period from COVID and the role that social protection will play. One point I want to make, and actually it dovetails nicely with the discussion at the end of the previous presentation, is around universality and the fact that universality does not equal inclusivity or reaching the poor, right? I think there's many demand side constraints that the poor face, particularly in rural areas, rural communities. Quality is always worse in rural areas and in poorer communities, which means you need to prioritize attention and focus provision of public services on the poorest and underserved areas first, right? Because even when you roll out a national program, a universal program, it's always the rural areas that come last and the poorest areas that tend to come last. It's also true in terms of recovery programs. Not all recovery programs are equitable. In fact, they're usually not equitable, which means as we go into building back, we need to prioritize the actions towards the sectors of the economy that are most relevant for the poor. That's the small and medium producers and businesses, particularly in rural areas. It's about recuperating the formal, informal, and temporary employment and improving working conditions along the way, focusing on safe and orderly migration. I think when we look at what is the FAO's role in social protection, I mean, it's quite particular. I mean, we work very closely with the World Bank and other agencies and governments in terms of expanding and scaling up social protection and the importance of doing this, particularly in rural areas among rural populations, but also the importance of social protection plays in terms of fostering economic inclusion, which will be central to a process of economic recovery, which is able to address the inequality that's been exacerbated by COVID. It's allowing households to move from a survival attitude to a planning for the future, right? And being able to invest in the future as this, having this basic, risk management instrument. And this is fundamental for those households that are, most of whom are own businesses, right? They produce for themselves, they're not wage employees. It's about helping households manage risk. It's about providing some measure of insurance, about helping facilitate access to credit. It's about relaxing liquidity constraints and helping them smooth consumption. And this is why it's so important to combine and coordinate these measures with measures to support small-scale producers and traders throughout the agri-food system and throughout rural communities. There's about 3 billion people in the world who actually depend on small-scale production of food, at least in part for their family income. And so they're often the same people who are receiving social protection programs. And so it's fundamental that we make that linkage and we understand how to coordinate those programs better. And by addressing demand-side constraints, whether it's demand-side constraints in access to social services or in access to other kind of public support around livelihoods, it's a key element in terms of making these policies inclusive, and in particular in making universal policies inclusive. Thank you.
Thank you, Benjamin. I do have one question for you. What role can social protection play in terms of the building back better and economic recovery that you mentioned, particularly in light of discussions around food systems transformation and the upcoming Food Systems Summit?
Oh, thanks. And I quickly answered one of the questions that was in the box around the role of social protection in the Food Systems Summit. And I think is a central part to Action Track 4, which is around equitable livelihoods, right? I mean, the Food Systems Summit, all this discussion around food systems transformation, it's really about making, achieving these goals in terms of environmental sustainability, addressing climate change, this whole issue around healthy diets. But key to all of this is really the livelihoods of, again, these hundreds of millions and even billions of small-scale producers who are depend on the food system for their livelihoods and will be going through this transition. And as I was mentioning, social protection plays a fundamental role in terms of, on the one hand, facilitating transition while people are, looking for a better future. But again, remembering that most of the poor are self-employed, or depend on multiple livelihoods, right? Without access to any way of managing risk. And so social protection is just like the basic, fundamental, minimal, often only formal way of managing this risk, right? And so I think if we really expect to have any success in terms of a successful transformation of our food systems towards these goals around environmental sustainability and climate change and healthy diets, social protection has a central role, not only in facilitating the transition, but also in promoting the transition itself. Thanks.
Thank you for your answer. I'm going to turn it over to our next panelist, Asma Lateef, who is the director for Bread for the World Institute. Asma.
Good morning. Thanks very much for inviting me to be part of this wonderful panel and such a timely discussion and conversation. I'm not a technical expert on social protection or have the implementation expertise. So I'm really going to focus on, from an advocacy perspective, how important these programs are. And I'm going to make three points. The first is these programs are working the way they're designed to work. In the United States, the SNAP program has expanded to meet the need. And Congress has stepped in to make some key changes or flexibilities to allow the program to really respond to this urgent crisis in the United States. And I'm sure Arloc will speak further to that. And on the international side, we have learned the lesson from the 2008 financial crisis. During the food price crisis and the financial crisis in 2008, it was clear that the few countries that had social protection programs were actually fared much better than those that didn't. And so it was heartening to see in Michal's presentation and through Ugo Gentilini's work, how many countries now have some mechanism in place to really respond to meet some of the needs that are emerging in the COVID crisis. And I say emerging because we still are right in, I would say, not even the middle of this crisis. We are still, the end is not in sight. So we have to really think about these programs for the long haul. And it's really, there are some really good examples in Ethiopia, the Productive Safety Net program. The people who are participating in the households that are participating in those in that program have actually not seen much change in their ability to access diverse diets or in their food insecurity. This is still early days and fresh data, but you're seeing some results. In Cambodia, we saw a program that Save the Children and USAID piloted and a project that they worked on over the last 6 years. In February, it was an integrated nutrition program called Nourish that was bringing health, nutrition, WASH, and agriculture together. A conditional cash transfer program. And in February, they had just handed it over to the government of Cambodia. And it's really been great to see how that program has pivoted in light of COVID to respond and to scale up cash transfers to households that were participating. So these programs are there and they're working. And so that's my first point. My second point is, as an advocacy community, we really need to think differently about how we talk about safety net programs, and we need to reframe and reposition these programs, reposition the role of the safety net programs. Some, the earlier speakers have already touched on this, but these programs are really an investment in the future. What a crisis, a short-term crisis can turn into a long-term challenge, especially if it hits in that 1,000-day window between pregnancy and a child's second birthday. If you don't get access to the right kinds of nutrients and the right kinds of interventions quickly, that short-term crisis can become a long-term crisis. So these safety net programs are playing a function of preventing that long-term impact. And then the long-term impact is in education outcomes, it's in income down the road, it's in economic growth. So the crisis that we're living through right now, if we don't mobilize and reach people who are in immediate need, we will feel the impact of this down the road. And so countries that are already feeling the fiscal burden of the economic impact of COVID, I think it'll be very challenging to maintain and to scale up the kinds of interventions we need unless we start to think of these as investments in the future. And, I look at a program like WIC in the United States, the Women and Infant Children Supplemental Nutrition Program. That program is really key to nutrition outcomes for young children. It is reaching communities that are really hard, really need the program. And it has quite a strong participation rate, especially amongst communities of color. It leads to better birth outcomes, it leads to better health and healthcare outcomes, and it leads to better education outcomes as we think about preschool and school. And yet, we don't frame WIC in that way. We don't talk about WIC in that way. And so I think it's incumbent on us as advocates to really start to look at how we talk about these programs and the role that they play, both in terms of resilience and building resilience in the short run, but also in terms of our long-term goals. And then my final point, going back to the theme of building back better, I think there's a lot that we need to think about in terms of leveraging these platforms. And aligning these systems to deliver better. Somebody, Benjamin mentioned the Food Systems Summit and the discussions around safety net programs there. We need to be thinking really about how do we align our health systems, our food systems, our safety net systems to really leverage each of these systems to deliver better outcomes. And from a development perspective, we need to be thinking much more about how do we move from interventions to system strengthening, building the capacity of countries to really to build the backbone of these systems that we rely on. I mean, one of the things, the main challenges with COVID was the shutdowns, the borders being shut down and countries really having to, impose movement restrictions. Safety net programs at local, at subnational and national level need to be there to be responsive over the long term. And I think that's a lesson we should take away from this, that we really need to transition away from thinking about projects and interventions to really thinking about system strengthening. So I'll stop there, Eric. Look forward to the conversation.
Thank you, Asma, and I really appreciate your comments. Have a question regarding your, Birth of the World Institute's 2020 hunger report. In your hunger report, you clearly state that the most prevalent cause of death worldwide, as well as causes of comorbidities among severe COVID-19 cases, are diet-related. The report then goes on to urge food-based dietary guidelines and safety net policies. Can you talk a little bit about what that looks like and if there are any examples that we should be looking to emulate?
Absolutely. So it goes to my point about really leveraging the systems we have in place to be able to deliver the outcomes that we seek. And so, in the hunger report, we talk about the alignment of systems around nutrition outcomes and how do we leverage these platforms to deliver better nutrition. And so an example of how we could do that better is thinking about, for example, at the education system, school meals, and strengthening school meals to be able to deliver more nutritious foods, and using that platform of school meals to also, engage smallholder farmers, for example, who are producing vegetables and fruit and, nutritious crops in the local community, both here in the United States and elsewhere. We have these platforms that are already in place, but we are not using them effectively enough to deliver on the outcomes. And we all know, and it's been stated already by earlier speakers, that good nutrition is key to all the goals that we have in terms of economic growth and education outcomes. So leveraging these platforms to deliver on the dietary guidelines means you look at them differently, you design them differently, you look at how you can engage local producers, how you can use nutrition education, how you can do nutrition education through those platforms. That's just one example, but I'll stop there.
Great. And if people are interested in learning more, where can they find the Hunger Report?
Thank you for asking. hungerreport.org. Thanks, Eric.
Sure, no problem. I'm going to turn over to our next panelist, Ms. Valerie Schmidt. She's the Deputy Director of Social Protection Department at ILO. Valerie?
Thank you so much for inviting the ILO to speak at this very interesting, important conference. So good afternoon, everybody. Good morning for those on the other side of the Atlantic. I'm based in Geneva. So the COVID-19 pandemic, as the previous speakers have said, has really alerted the global community to the importance of social protection. It has also shown that it's not only the poor who are in need of social protection, but all the members of society from all countries. Everybody can become vulnerable in the absence of universal and comprehensive social protection systems. And as Michal and other speakers explained, prior to COVID-19, we were already aware of the lack of social protection globally, of massive coverage gaps. We were not sleepwalking, but despite this global awareness, there was insufficient political will to make social protection a priority, or the extension of social protection a priority, to cover all the population. So COVID-19 has at least been beneficial for one reason. It has put social protection high on government's agenda and on agencies' response to the crisis. So what we can see is that in all countries, social protection was one of the priority responses to the crisis. According to our monitor, we have also a monitor at the ILO Social Protection COVID-19 Monitor. Within a few months, nearly 1,600 social protection emergency measures have been adopted in 209 countries. Togo, for instance, launched a new program called Novici, which means mutual help, to support informal economy workers in an urban setting that were the most affected by lockdown measures. And if there's a positive aspect to this crisis, it's indeed the widespread recognition of the necessity of extending coverage to the informal economy workers and other groups of society that are today excluded. The crisis has also taught us that with political will, actually, countries can make social protection a reality within a few months. However, the challenges are still immense. Even before COVID-19, we estimate at the ILO, we are through our World Social Protection database, that 55% of the world's population had no access to social protection at all. This means that 4 billion people are still excluded from social protection. And in some regions, this exclusion is much bigger. In Africa, for instance, it's 92% of the population that has no social protection at all. The other thing that we know also is that this insufficient coverage gap are linked to significant financing gaps that existed prior to COVID-19. And according to our estimates, low-income countries would need to invest an additional US $78 billion, or 16% of their GDP, to close the financing gap in 2020. So if we look at Africa, current investments in social protection and health represent 5.6% of the country's GDP on average. To close the financing gap, we would need an additional 8.2% of countries' GDP, which means that African countries should multiply by 2.5 their current investment in social protection and access to healthcare. So if we really want to achieve the human rights to social protection and health by 2030, we need to invest much more in social protection. And these additional investments need to be sustainable, and therefore they should come primarily from national resources. Countries have shown that there are many ways to increase domestic resource mobilization through the reallocation of public spending, such as from fuel subsidies to social protection benefits, or the creation of new taxes, such as taxes on natural resources, or new income tax, or the extension of contributory social protection. But many more options exist and have not yet been fully explored. However, in low-income countries, domestic resource mobilization will not be enough. And these countries should be able to seek international support, at least for a temporary period, and if we really want to achieve the SDGs on social protection by 2030. But this additional financial support should not be helicopter money. And as Asma said, this additional financial support should really be used to support national institutions, national counterparts in creating sustainable systems, in mobilizing domestic resources for social protection on a sustainable manner. And this can happen. It was the case of Kenya, for instance, between 2007 and 2016, when the government has progressively allocated more resources to social protection and reduced its reliance on resources coming from the external partners. So we need to invest more in social protection, but this is not sufficient. We also need to invest better in social protection by ensuring that the mobilization and allocation of resources is fair and equitable. Investing better implies, for instance, that we respect the principle of solidarity in financing between different groups. Here we are not talking only about risk sharing, but also about redistribution between high and low income earners, between those who are in good health and those with preconditions, between urban and rural setting, between those in the labor force and those who cannot work. Investing better means also that social protection systems are not only sustainable financially, but also they should be sustainable socially. And this can only be achieved if all the members of societies share the same vision for social protection and that there is a real national consensus on social protection solutions. Investing more and investing better can only happen if there is more coordination between the actors at the national level, and especially between the Ministries of Labor, Social Welfare and Health on one hand, and Ministries of Finance on the other hand, that all these actors share a common vision and a common roadmap for the development of their social protection systems. Investing better also can only happen if there is more coordination between the ILO, other UN agencies, and also those who are supporting the Ministries of Finance, especially the World Bank, the IMF, other development banks, to avoid conflicting messages and conflicting policy advice at country level, and really to join forces to link the policy support that we can provide with financial support. At the ILO, we are a standard setting organization, and one of our standards on social protection is the Social Protection Force recommendation that was adopted by all our member states, represented by the Ministries of Labor, the Workers and the Employees Organization in 2012. And this standard could really be used to draft this common roadmap on investing more and investing better. Indeed, it has a number of concrete principles that are already implemented in many countries to build nationally defined and owned social protection systems that protect the whole population and leave no one behind, that are financially sustainable, but also socially just and rely on sound management and governance and provide good value for money. So to conclude, we cannot stop here. The social protection response to COVID has been amazing, but we cannot stop here. Current and upcoming challenges call for strong, responsive social protection systems to protect workers and their families and to facilitate the transformations of our economy. And as many are saying, to build back better. Thank you.
Thank you, Valerie. Question for you is, has COVID-19 helped to advance universal social protection coverage on a global scale?
So it's too early to see whether COVID-19 has helped scale up social protection coverage. As Michal explained, most of the COVID-19 emergency measures have only been temporary, providing income support for, as he said, an average of 3 months to vulnerable populations. In Bangladesh, for instance, a temporary cash transfer allowance program that is implemented by the Department of Labor with financial support from the EU and Germany and our technical assistance provides unemployment benefits to ready-made garment workers that were prior to the crisis excluded from any social protection system because there is no national system in Bangladesh so far. However, these measures are only temporary. So for the time being, it's we can celebrate that at least these temporary measures have been implemented. But I think we need to do much more. We need to ensure that countries use the current political momentum and transform these temporary measures into sustainable social protection systems. And actually, this is happening to some extent in Bangladesh or other countries, where the idea is really to transform this short-term assistance into the design of sustainable unemployment insurance schemes for the government sector. So it's now, or it will be never. So I think we should really use this momentum.
Thank you. Appreciate your comments. Our final panelist is Arloc Sherman. Mr. Sherman is the Vice President for Data Analysis and Research at the Center on Budget and Policy Priorities, and he will talk about social safety nets here in the United States. Arloc?
Thank you, Eric and Valerie, and good morning and afternoon to everyone who's joining us. I'd like to add to what my fellow panelists have been saying by using the US as a model of what to do in some ways and what not to do in others. Given how wealthy a nation the US is, families to a surprising degree here are not faring well because our social safety net system is decent, but not resilient and flexible enough to respond in a time like this. A bit of context, as in other places, COVID deaths in the US declined in the summer, now setting daily records. The number of jobs fell 13% from February to April in the US, and while it has rebounded a bit, are still down 7% from pre-pandemic levels, and assistance levels, I think, rose more than that and fell more than that. And so if you had a consistent graph of monthly poverty status, which I haven't seen anyone produce, but if you did, I think it would look a lot like the graph Michal showed about childhood wasting, that poverty fell through 2019. I think that you would see it falling actually even more in the early months of the pandemic as we got some assistance out the door, but now is back up to where it was in 2010. Our Census Bureau started, to its credit, a new weekly survey during the pandemic to see how well people are faring. And it's a little troubling. In November, 1 in 8 adults, 26 million Americans, reported that their household sometimes or often didn't have enough to eat in the last 7 days. And this was several times above the pre-pandemic level. And 4 out of 5 of those, when asked, said the reason they weren't getting enough food wasn't, food shortages or difficulty shopping, it was they couldn't afford to buy more. And for over 40% of children in renter households in the US, their families are either behind on rent or the household is not getting enough food to eat, or both. So in the US economic security programs, the glass is half full, half empty. We have been much more effective in our safety net than 40 years ago for most groups in society. We now lift above the poverty line about half of those people whose incomes would be below the poverty line if you didn't count their safety net assistance. So we're, in that sense, the glass is literally half full. We're lifting half the otherwise poor people above the poverty line. That's, that wasn't the case 40 years ago. We lifted maybe 5% of people above the poverty line. But in the 1990s, we weakened our safety net for some of the very poorest people. We cut back food and cash assistance for immigrants and for childless adults who can't find stable work. And so it's a very mixed picture. I'm going to stop there, but thank you.
Thank you, Arloc. Question for you is, social safety nets clearly provide families with much needed relief, but they also provide communities with economic benefits. Could you talk about this a bit and explain some of the other benefits, especially during this current crisis? that safety nets can provide that we don't always hear about?
Yes, absolutely. One of the lessons from the recession we went through a decade ago was that the most effective policies for stimulating the economy involve public spending with a high bang for the buck. If demand is low, you want policies like food assistance that target low-income households, because those households will turn those dollars right around and spend them. In a US government study, the US Department of Agriculture from the last recession said every dollar on the food assistance program, SNAP, it's called here, resulted in $1.5 in economic output. A study just a few months ago from economist Mark Zandi at the investment firm moody'seconomy.com, they put it even higher. Each food assistance dollar yields $1.67. Those were just about the highest fiscal multipliers of the dozens of policies Moody evaluated. And you also saw high multipliers like that for other help for low paid or laid off workers. The multiplier for across the board stimulus checks was lower at about 1.06, and the multiplier for small business grants was a mere 0.8 or so. So the moral imperative to help the people who are suffering the most actually lines up pretty well in this instance with macroeconomic efficiency. A second point, as Asma said, it's not just short-term benefits. Investments in the families who need them most can also yield lasting benefits for children's health and economic outcomes. Just last year, a report from our National Academy of Sciences concluded authoritatively that family income's impact on children's health and education was not just a matter of correlation, it was a matter of cause and effect. In one study they cited looked back at this country's gradual rollout of food assistance in the 1960s and 70s and found the extra assistance reduced stunted growth and reduced children's later heart disease by 5 percentage points and lifted high school completion rates by an astounding 18 percentage points. So these things are good for the country in the long run too.
Thank you so much. And I want to also just thank all of our panelists for their comments and sharing their expertise to this critical question. To all these critical questions. And we're going to turn it over to the Q&A from our audience. We actually have a question for Michal and Valerie about what is the role that the international donors can play to help strengthening social protection systems, and what are the critical gaps that they can fill?
Thank you very much, Benjamin. I saw this question also on the chat from Lara Evans from USAID. I think there are two levels that are of essence here. One is the global level, the other is the country level. At the global level, it is important to first coordinate policies, which we recommend. And in order to make it happen, which is not to say that it happens sufficiently or adequately, but we have a body called Social Protection Interagency Coordination Board, which is co-chaired by ILO and World Bank, and it brings together multiple international organizations and bilateral donors. And what we have been doing for years is essentially a show and tell meetings in which we compare what we do. And we are now in discussions how to elevate those debates to better coordination, which could be more meaningful at the country level. We also at that global level try to unify by objectives. One of the objectives we share is Universal Social Protection 2030, what I referred to before. We also try to be practical. So, for instance, one among the SPIAC-B, as we call it, Social Protection Interagency Coordination Board, I think among the SPIAC-B initiatives, the one that has been probably the only one I would say it's really successful is so-called ISPA, Interagency Social Protection Assessment Tools. ISPA tools, we call them, when we're trying just to use the same tools to make assessments of social protection systems, as opposed to different ones, which may not be that helpful to the client. So there is a lot happening at the global level. This is an important arena. And the second level I already mentioned is the country level. And I think at the country level, again, there is obviously a very simple call for better coordination. But this coordination in most countries is actually happening in terms of regular meetings, in terms of regularly exchanging views and comparing notes. I think if I think you ask me about how to be more ambitious in this coordination, I think we may be more ambitious in delivering some tough messages to the governments. For instance, in Africa, in the poorest countries of Africa, most of social safety nets are really 80-90% donor financed. And usually this is a combination of the World Bank and other donors, bilateral, multilateral, some bilaterals like the UK, Germany, France, US play a very important role. And what we are united with the objective that it's not sustainable that the donors finance 80-90%. The government needs to have a plan to raise their own financing step by step. I think we could be more coordinated in delivering this message to the government, more concerted, because this is what unifies us all in terms of how we understand sustainability. But sometimes organizations have short-term spending pressures and think, so we are not as consistent as we should be, I think, in this area. So that's how I see the coordination. And over, I think I have some other responses to what was on the chat, but I will do it later. Thank you.
Yes.
Valerie, go ahead.
Yes, thank you for this very good question. And I don't want to repeat what Michal said, so I will just complement what he said. The coordination at global level indeed happens through the SPIAC-B, the Social Protection group that is co-chaired by the ILO and the World Bank. In addition to this group, there is, as Michal said, this USP 2030 initiative. Why it's very interesting and important to have the USP in addition to the SPIAC-B, it's because in USP, the members are also member states, are countries. And this, I think, adds an additional layer of coordination. It's ensuring that the great ideas and the great policies that the international organization follow and develop are really implementable, applicable, that are feasible and are relevant for the countries. And also it's ensuring that development partners can really, as one, support the national social protection strategies and policies of these countries through integrated, coordinated approaches. So I think this combination of agencies and countries, plus also civil society, trade unions, etc., that are also part of these groups, is very important. At country level, I think we need to do much more. We have already, I mean, there are already a number of bilateral collaborations between ILO, FAO, ILO, UNDP, ILO, UNICEF, World Bank, UNICEF, etc. But I think when it comes to providing the technical support, we could improve. Why? Because we all have different constituents. For instance, the ILO works with the Ministry of Labor. UNICEF often with Ministry of Social Welfare, the World Bank with Ministry of Finance or Social Welfare, FAO maybe with Ministry of Agriculture, etc. So we, as a group, we have the potential to be able to talk to these different constituents. In addition to that, many of us work with civil society. At the ILO, we also bring the employers, which is the business community, and the workers' organization, the trade unions. So with all this, we could really make a much stronger advocacy for investing more and better in social protection, we could ensure that this lack of consistency in our messaging when we are working with countries is diminished. We could ensure, for instance, through large national dialogues involving ministries of finance, central banks, and the different technical ministries, civil society, workers, employers, to ensure that the great ideas that many of the technical ministries have in terms of social protection development are followed by ministries of finance that are able to finance these policies. So there is more dialogue that needs to happen between the financial side of social protection and the policy side, implementation side of social protection. So this is why with a number actually of development partners, we are calling for more coordination, not only at the global level, but also through our country operations based on a common roadmap that we still need to write. But we have, as Michal said, a long history of collaboration. So I'm really confident that we can make this happen. Over.
Thank you. Another question from the audience is, is this work linked to the work carried within the Interagency Standing Committee and other resilience efforts? I don't know who can answer that, but.
I think it would be useful to explain which interagency standing committee is meant here, because I don't know, just asking for clarification.
I don't know. We can go to another question.
Is it related to emergency response? Is it related to OCHA? What is this interagency standing committee?
Let's refer to the emergency response. Let's go there. We can respond to that later. Here's another question. Could one of the speakers give an overview of different forms of social protection? For example, cash transfer, employment, nutrition assistance, and how can policymakers decide what is the most fit for specific purposes?
Valerie, you want to do it?
I know, I'm curious to listen to you, Michal, to see what you're going to say. Oh, you want me to say?
Okay, no, I very briefly, so maybe it's useful indeed. When we say social protection, we mean indeed the range of instruments, but the easiest way of breaking them down would be to divide them into social assistance or social safety nets. And this was majority of response in crisis. They could be in cash or in kind, or a combination of both. And as I already mentioned, social assistance, social safety nets means the same, just given different sensitivities, different terms are used in different groups of countries. These are non-contributory last resort benefits in cash or in kind, and essentially, at least in the World Bank, we would think to help alleviate poverty directly, to help first the poorest, the most vulnerable, and if possible, others, and affected by shocks in the case of COVID. Then we have a second group of social protection mechanisms, and those we would call social insurance, because they are based on a contribution paid upfront. And the typical social insurance programs are old age pensions, disability pensions, survivorship pensions. Those instruments are prevailing, are dominant, in fact, in high income and upper middle income countries, where most of social protection, if you look at shares of GDP, goes through pensions, either old age or disability or survivorship. And the difference with social assistance is that a participant has a feeling that he or she paid for it by paying social security contributions. Without getting into details who pays those contributions, this is This is an entitlement to be drawn upon once the risk materializes, the risk being in old age and not able to work, being disabled, or being actually a survivor after husband or wife passed away. That's the second group. And within that group, we also would, many countries would call unemployment insurance if they structure their unemployment benefits system as an insurance system when you pay something up front. Some countries may choose to have an unemployment benefit paid out of general revenue, in which case we would not call it insurance, we would say it's unemployment benefit. So there is a gray area there. Finally, labor market policies of all kinds, typically we divide them in active and passive. Passive are unemployment benefits, are just referred to them, they can be paid as insurance in insurance type or directly. And then you have all kinds of active labor market policies, which are aimed at, if I may use the phrase I like, preparing workers for change, meaning that they got training, they get coaching, they get mentoring. There could be a wage subsidy associated with that. There could be a one-off asset grant, asset transfer so that they can start their own business. All kinds of measures that are aimed at increasing employability of a participant of the workforce. And obviously within that you have some very particular niches, like we all want everybody to have good jobs, but good jobs are not always possible. It's better to have not so good job than no job. So there is a big agenda called graduation agenda or economic inclusion agenda, which is about how to get people who are actually totally in the informal labor market and without sustainable livelihood to get them to those sustainable livelihood before they get into good jobs later. So there are various shades of gray within this realm of instruments. And then in the World Bank, we also actually believe that it is not productive to just talk about active labor market policies without covering the demand side of the labor market. So the jobs group that is a part of global practice I have an honor to lead also covers the demand side of the labor market and issues like value chains in agriculture, issues like development of firms so that they they offer more employment. These are just a very brief one-on-one on social protection instruments, the way I see it. Over.
Yeah, if I may add to what Michal explained, so the structure, social assistance, social insurance, active labor market policies, I fully agree. Then what is important to know is that for social insurance mechanisms, in most cases, these mechanisms are financed jointly by the workers and their employers. So there is a sort of solidarity or shared responsibility by also the employer to finance the social protection of their worker. And this makes a lot of sense in terms of a good business sense for many reasons. Another thing I wanted to add is that for all these social protection mechanisms, the ILO since 1919, because we are 100 years, even more than 100 years old, we have developed standards. So when I say the ILO, it's our constituents, our member states, so represented by governments, workers, and employers, have developed standards that are pieces of international law that can guide the design of these social security mechanisms, both social insurance and social assistance, and their linkages with active labor market policies. And among these standards, we recognize 9 branches of social security. So Michal mentioned pensions, but there is also access to healthcare, sickness benefit, unemployment protection, as Michal said, work injury, etc., maternity, which is very important. So all these different risks actually that happen in life can be covered through social protection, either social assistance or social insurance. Last but not least, during the discussion, the panel discussion, there was a lot of emphasis, including by Michal, to really expand social protection coverage to the informal economy, and the recognition that it's not possible to cover 80 or 90% of the population of a given country through social assistance. So there is a need to combine Sometimes social assistance, sometimes social insurance, but of course the social insurance mechanisms for informal economy workers cannot be the same as the ones for the formal sector workers. For this, the first reason is that many informal economy workers are self-employed. They don't have an employer. So how do you finance this protection? So many countries have started by developing a simplified regime. And we are, for instance, at the ILO supporting Senegal and Burkina Faso in developing their simplified regime for the informal economy workers. But this includes a lot of work on the policy design, on the financing, on also the administration, because how do you administer these schemes for populations that are often in rural areas and are based far from the cities where the social security services have their offices. So there are many, many questions around this extension. And what is also interesting is that the extension of social security to the informal economy is also the first step towards their formalization. So again, to go back to the active labor market policies, it's very important to link access to social protection with other measures related to a better structure or strengthening of your small and micro enterprise, to the development of your skills, including skills in accountancy, for instance, so that your small enterprise can become much more strengthened and progressively formalized. And like that, you have access to social protection, but you are also contributing to the state's budget by paying taxes. So it's a win-win investment. Over.
Thank you both. I have one question for Arloc, and then I will ask two more questions after that. Arloc, we know you really have your ear to the ground concerning a lot of data related to safety nets. How has the current crisis strained programs here in the U.S., and what would you recommend to make these systems more resilient the next time we are hit with a major economic shock?
Yeah, so the big policy lesson, I think, from the US is that we need to make programs more responsive than they are. We need to use economic triggers more in a recession to automatically trigger more assistance whenever the unemployment rate goes up over some amount. That's something we can write into law. So to build on what Michal and Valerie were explaining about the different kinds of assistance, one major dimension is, does assistance serve everyone who qualifies? In the US, assistance programs like housing are a fixed pot of money every year that Congress sets, and they may add more, but they basically stay the same. Others, like food and medical assistance and unemployment benefits, automatically expand when more people apply, but they don't necessarily expand enough. And an example is unemployment benefits. Every single recession since World War II, Congress has had to come in and pass laws to increase the amount of unemployment assistance, even though, as I was saying, it's designed to let in everyone who meets its qualifications. So why is that? If Congress didn't act, people would run out of benefits after 6 months, usually. A lot of unemployed people don't qualify for unemployment insurance because we don't give that program to people who have very low earnings or who work for Uber in the gig economy. For example, there are a lot of gaps in these programs. So Congress fortunately fills in some of those gaps when a recession comes, but often Congress comes in too late. By the time they've worked out a political agreement, it's coming too late and so forth. So one of the big lessons is that if you were to draft into statute, if you were to write into law automatic trigger, so that when unemployment rates, say, exceeded some percentage, then you could have automatically more weeks of unemployment benefits offered, not just the normal 6 months. You could have we've had to expand the kinds of jobs to cover the gig economy. Actually, that's a kind of permanent fix that ought to be there in recessions or not in recessions, but sometimes you need triggers to let in more kinds of people, extend the benefits, extend the amount of benefits. The food assistance program in our last recession, we increased the maximum benefit by 13% in the food assistance monthly benefit level. That's the kind of thing we should be doing more of so that we're ready the next time a crisis hits.
Thank you. And one last question, then I will turn it over to our speakers for final remarks. But one last question to Asma. Just politically here, what would you say are some of the most important safety nets as it relates to food security here in the United States? And then are there current debates happening right now in the US to expand these programs?
Yes, thank you. So SNAP and WIC, I think Arloc has mentioned SNAP and the Women, Infant and Children program that I mentioned earlier. Those are really at the forefront of nutrition assistance. And then of course there are the school meal programs, that school lunches and breakfasts that have been really critical to meeting the needs of low-income children. Those, of course, have been really hampered during the COVID crisis. So there are, as we look ahead to hopefully a stimulus, the next COVID bill, it's really critical that Congress increase the SNAP benefit by 15%. That's the ask of the community. It's been really challenging as a community to get to really get the political attention to the hunger crisis and it's gotten all mired in the politics of this time. And it's really, as we are seeing the devastating impact on food insecurity in this country. And so, that is a key piece that we hope will get done. But as I said earlier, we really need to reframe the way we're talking about these programs so that they are tied to our long-term recovery much more closely.
Thank you, Asma. And we're wrapping up. We have about five minutes left. So I want to take time to have our panelists give any final thoughts, quick 1 to 2 minute final thought. I'm gonna start with Michal. Michal, what would be your final takeaway for the audience?
So my final takeaway would be and Valerie, I think, referred to that to focus more on sustainable financing for social protection. And to do that, we need to be open-minded and look broadly. There is a clear room to improve in this area in developing countries. A few avenues, closing loopholes and exemptions in regressive VAT may generate considerable revenue. Excise taxes, for example, on tobacco, another source of potential revenue. There are numbers showing that these are quite serious potential sources. Carbon taxes have already become increasingly prevalent, but that's another source. Elimination of energy subsidies, big deal for us. Still, energy subsidies are all over the place. They are regressive. They are supporting more those who consume more energy. Converting them into cash transfers into social safety nets would be a big step forward. And for instance, in the Middle East and East Africa, spending on such subsidies often completely dwarfs spending on social assistance. The ratio is 3-to-1. And then I would go even further into assets, because Gini assets is 0.8. Gini income is between 0.4, 0.5 in most developing countries. So without looking at things like immovable property and taxation system there, would be very difficult to do that. It is important to get there. So I just wanted to see that the tax architecture need to be reviewed with a view of sustainable financing for social protection. And then my second and last point as a conclusion, and it somewhat refers to what Songitu asked in the chat, private sector role. We do need important private sector role in social protection. I think the best things happen, including in social protection, when there is a private-public partnership, not in terms of the narrow definition, but more broadly. We have seen it in pensions area for years through participation of private pension funds being a part of social security system. I'm not talking about private pension funds operating outside it. But then, if you look at the most promising innovations now in COVID, this happens in the area of covering informal sector with social insurance. Just tomorrow, we'll be discussing the Pakistan programs when mobile wallets will be used for the purpose of participants in the informal sector paying contributions to what would be their contingency against risks of being old age with no work, disability, inability to work. And here we have a system in which it's operated by the private sector, regulated by central bank, and within a framework established by the Benazir Income Support Program, which is a big institution, government institution. So you have government, you have central bank, regulating private sector operators that do both collection of contributions and payments in needed. A good example of private-public partnerships. We need more of those in social protection. Thank you very much, and over.
Thank you. Benjamin, final thoughts.
Yeah, no, I'd just like to pick up on Arloc had said around the multiplier and just the importance of really considering social protection, and I think even social assistance, as something that it really needs to be a complement to, let's say, livelihood and jobs programs. You know? On the one hand, it does have this, it can have important multiplier effects in terms of, generating demand within the economy, and it can have impact on people who aren't receiving the transfer themselves. But I think it's also very important in the context of where, particularly in those development contexts where people are self-employed, where they face a lot of market failures, where there's a lot of, they don't have access to a lot of formal mechanisms of insurance or risk management. Social protection is the one, formal thing that they can often hold on to. And so it's very difficult to see. I mean, you really need to look at the economic livelihood together as a complement with addressing the social context of families and households. Thanks.
Thank you. Asma?
Thanks. I think we really need to take advantage of this window, this moment that we're in, where people are really focused on the crisis at hand, to really make changes that will have a lasting impact. Too many people, for the foreseeable future, too many people will depend on safety nets. And in this country, too many people have not had sufficient income and have had to depend on a safety net program. So ideally, safety net programs are only there in an emergency. But for the foreseeable future, we're going to have to really depend on these programs to help lift people out of poverty. And as we look ahead to achieving the Sustainable Development Goals, how do we invest in these programs, leverage them, align them with other systems so that we are really moving people out of needing these programs and that they are truly there just for emergencies. We really need to get there.
Thank you, Asma. Valerie, final thoughts.
Yes, sorry. Yes, thanks a lot. I think I would like to remind us of 10 years ago, in the aftermath of the 2008 global financial crisis. The UN launched a number of joint initiatives. One of them was on social protection floors. And at that time, the idea was really to promote or to recall that social protection is a human right and needs to be a reality for all. And I think this UN social protection floor initiative is still present, is still vibrant, and we need to really ensure that in the next decade in order to achieve the SDGs on social protection, we are putting money behind the words of social protection floor and the right to social security. And for that, as Michal said, we need to really increase our work, our efforts on building sustainable financing options for social protection that are really driven by country ownership, that are really based on a national consensus for the development of the social protection system. But we need to explore more options. There are many options that are still unexplored. And we should also not forget that social protection is not only about managing risks, it's also about creating more redistribution of income in a society and creating more solidarity. Social protection is a mechanism that brings the solidarity that exists normally in all families, in communities, at the level of a nation, of a state. And sometimes some people also talk about global solidarity. So it's really important not to forget that, so that we can, through the financing mechanisms, but also the design of social protection policies, ensure that, of course, we don't leave anyone behind, but also that these social protection systems are fair, are just, are equitable. So I think it's really important to scale up our effort, and we cannot do that alone. As I was saying, we have many cooks in that kitchen. All the cooks have great recipes. So it's very important that we join forces and that ministries of labor, ministries of social welfare, health, education, agriculture speak to ministries of finance and vice versa. And the ILO, UN, etc., with the World Bank and the IMF and vice versa. I think I will stop here. Thank you.
Thank you. And last, Arloc, final thoughts.
Austerity, I think, is my closing word, and we should not, I think, go there in this kind of moment. There are 13 million jobless people in the United States who are scheduled to lose unemployment and assistance in a few days. And Congress has dragged its feet about extending help. They've already lost the bulk of their assistance. We used to spend about $5 billion a day in the US on unemployment benefits at the height of assistance in May, and that's fallen to a fifth of that. Still 7 times more than we spent before the pandemic, but we're at a moment where we actually need it more. Unemployment, the need for unemployment is rising. We've seen in many ways it's wise for the next generation not to let people fall through the cracks. And we need more responsiveness, not less. And that includes more trigger mechanisms of the kind I described for assistance programs. I think even for job creation programs I've mentioned in the chat. And I think that's very much in line with the human needs goals laid out by the other panelists. Thank you.
Thank you. And I want to thank all of our panelists for providing their time and expertise for this very important discussion and conversation. I also want to thank the Alliance to End Hunger staff, as well as the FAO North America staff, for putting this series together all of 2020. And this will be the last of this year, but please tune in. We will have more very informative discussions going into 2021. Thank all of you all for joining us, and have a good day.
Thank you.
Thank you, everyone.
Thank you. Thank you very much.
Thank you very much. Thanks for inviting me. Great to be here. Bye-bye. Thank you.
Thank you so much, everyone.